The question somebody was kind enough to ask is, why did I become a plastic surgeon? I wish I had like some grand story. Truly, I don't. I knew I wanted to be a surgeon. Surgeons, when I was in the hospital and medical school, they just felt like my people. And so I felt at home around them. And then a couple of people suggested I should be a plastic surgeon or consider plastic surgery. And I had a mentor named Dr. Elwood in Peoria who was kind enough to invite me in to see his practice and to mentor and teach me. And so the reason I became a plastic surgeon is probably Dr. Elwood. A different question that addresses probably, I suspect, what people mean when they ask that question is, why do I do what I do? And that is a little more personal. So I've talked to my mom. She's okay if I share this. So here's the story. When I started in practice, I did not do a lot of cosmetic surgery. I did mostly reconstructive surgery. And my mom was getting ready to have a facelift. And I sent her to a surgeon in Cleveland named Dr. Guyron to have that facelift. And as she was going through the process, she said, Jeremy, why don't you do this stuff? And I was like, Mom, I worked way too hard to treat people's vanity. And she said, Jeremy, you're an idiot. And she was right. And what she meant by that was this, because she later explained it. She said, when she looks in the mirror, she feels one age, and she feels like she looks a different age. And that disconnect, when she would look in the mirror every day, felt painful to her. She just didn't feel like how she was representing herself to the world was matched how she felt on the inside. She said she felt young and looked old. So she went through this process, and afterwards that was fixed. She felt more comfortable, she felt more confident. She felt when she looked in the mirror that who she was in the mirror was who she was inside. And that is such a powerful thing. And what I've learned since is that that's not vanity. She told me that. Vanity is doing something because someone else will think it's nice. What she did was doing something so that she would feel better about her own body. And in my early years, I just didn't appreciate how important that is. Now I see it all the time. I see it when someone walks in and they tell me they're uncomfortable getting undressed with the lights on because of the way that their bodies have changed, or the way that their body evolved, or the way children change things. And when I get to see that person walk in for their 12-week appointment with a little swagger, maybe wearing different clothes or wearing their clothes differently, I think you can get to realize quickly, like, that's a powerful thing. And there's not that many things that a surgeon can do, not that many fields that a surgeon can do, probably just this one, where I get to feel that. And to be honest, I love it.